This is the show that pits facts against filling up babies with shots. Today on the show, vaccines. In the US, there's been a ton of turmoil around vaccines. The Department of Health and Human Services is being led by a longtime vaccine skeptic, Robert F. Kennedy Jr. He's been accused of firing the head of the CDC for not rubber stamping his vaccine policy. He's also added a ton of vaccine skeptics to this big vaccine advisory committee. And President Trump has chimed in here saying that we've been giving kids way too many shots.
They pump so much stuff into those beautiful little babies, it's a disgrace.
And last week, the CDC announced a big change, saying they've got new vaccine recommendations for kids.
New guidance from the CDC reducing the number of vaccines recommended for children.
They have scaled back the number of vaccines, now only recommending 11 vaccines.
The CDC is now saying that some shots that were given to kids routinely instead should be given on a case-by-case basis, like to quote high-risk groups. And to back up these new recommendations, the government has pointed to what some other countries are doing. They say that when you look at the US versus similar countries, some of them don't give kids nearly as many shots. And there's one country in particular that's gotten pointed to a ton.
Denmark. I think Denmark a lot.
They're a pretty healthy country. Why shouldn't we copy Denmark?
Yeah, the CDC seems to be modeling its new recommendations on Denmark. So, is this a fairy tale come true for the US? Or is it more like a nightmare? Today we're going to find out, why do some other countries recommend fewer vaccines than the US? Does it make sense to follow their lead? And we'll look at what the fallout could be. Because when it comes to vaccines, there's a lot of
Beautiful little babies.
and then there's science. Science Versus is coming up after the break.
I was guilty of multiple skincare crimes. 2 counts of sleeping in makeup. 1 count of using disposable wipes. I knew my routine had to change. So I switched to Garnier Micellar Water. It gently cleanses.
Hi, this is Meryl Horn in for Wendy Zuckerman, and you're listening to Science Versus. This is the show that pits facts against filling up babies with shots. Today on the show, vaccines. In the US, there's been a ton of turmoil around vaccines. The Department of Health and Human Services is being led by a longtime vaccine skeptic, Robert F. Kennedy Jr. He's been accused of firing the head of the CDC for not rubber stamping his vaccine policy. He's also added a ton of vaccine skeptics to this big vaccine advisory committee. And President Trump has chimed in here saying that we've been giving kids way too many shots.
They pump so much stuff into those beautiful little babies, it's a disgrace.
And last week, the CDC announced a big change, saying they've got new vaccine recommendations for kids.
New guidance from the CDC reducing the number of vaccines recommended for children.
They have scaled back the number of vaccines, now only recommending 11 vaccines.
The CDC is now saying that some shots that were given to kids routinely instead should be given on a case-by-case basis, like to quote high-risk groups. And to back up these new recommendations, the government has pointed to what some other countries are doing. They say that when you look at the US versus similar countries, some of them don't give kids nearly as many shots. And there's one country in particular that's gotten pointed to a ton.
Denmark.
I hear Denmark a lot. They're a pretty healthy country. Why shouldn't we copy Denmark?
Yeah, the CDC seems to be modeling its new recommendations on Denmark. So, is this a fairy tale come true for the US? Or is it more like a nightmare? Today we're going to find out, why do some other countries recommend fewer vaccines than the US? Does it make sense to follow their lead? And we'll look at what the fallout could be. Because when it comes to vaccines, there's a lot of
Beautiful little babies.
and then there's science. Science Versus is coming up after the break.
I was guilty of multiple skincare crimes. 2 counts of sleeping in makeup. 1 count of using disposable wipes. I knew my routine had to change. So I switched to Garnier Micellar water. It gently cleanses, perfectly removes makeup, and provides 24-hour hydration. Clear away the evidence with the #1 micellar water worldwide by Garnier.
Welcome back. This is Meryl Horn. I'm here with my fellow senior producer, Rose Rimler. Hey, Rose.
Hi, Meryl.
So, we're talking about this vaccine news today. What have you been seeing about this?
I haven't been following it super closely. I have been following it a little bit. And one thing I saw on social media that was going around was this infographic where there were like 2 cartoon babies. One cartoon baby is surrounded by syringes, you know, a handful of syringes, but the other cartoon baby is completely encircled
Yeah.
with syringes, I guess, full of vaccines. And I think it was from Trump. And,
Yeah.
and it says, like in the text, it says, in the US, babies get 72 shots. And I was like,
Uh-huh.
is that true? That does seem like kind of a lot.
Yeah.
But the graphic was just so ridiculous too. So yeah, I've been following it. I don't really know what's true, what's not true.
We looked into that one. So, yeah,
Uh-huh.
I mean, it is true that babies get more shots today
Than in the past.
than in the past, yeah. But they're not getting like 72 shots. So the number,
Okay.
we did we added them up, and it seems like if you add up all the individual shots that someone gets by the time they're 18 years old, including getting, a flu shot and COVID shot every year, then you get 72.
That's where they got that from.
Yeah, so it's sort of true, but it's not that babies are getting 72 shots.
Right.
And then if you just look at the number of diseases that kids are getting vaccinated against, of course that number is much lower, right? Because it doesn't include all the booster shots.
So how many diseases is it?
So before this change, the CDC was recommending that every kid get vaccinated against 17 diseases. Now it's just 11.
So they took away 6 vaccines that they recommend for everybody.
Yeah.
Which ones?
Okay, so the recommendations changed for hepatitis A and B, meningitis, RSV, rotavirus, and flu.
Okay. Wow.
And they had actually already stopped recommending the COVID shot last year for every kid. So now those ones are only recommended to either high-risk groups or, quote, based on shared clinical decision-making, unquote. Which is basically the idea that you have a conversation with your doctor and decide together instead of it being routine.
Do more work to get the shot.
Yeah. Yeah, it's not as automatic.
Uh-huh.
And they do say that insurance will still cover these vaccines if people want them. But, on the whole, yeah, it makes it more messy.
Okay, Meryl, so in addition to the babies encircled with syringes, and it's apparently bogus, another thing I saw a little bit about these changes that came down, and like in the article it said, this will bring us in line with Denmark's policy. And I was like, Denmark? I mean, that's interesting because I think a lot of people in the US idolize Scandinavia. And everything they do is better thought out and smarter and better for children than whatever we're doing in the US.
Especially when it comes to healthcare, we're often like, oh, look at these Scandinavian countries. We should do everything. Yeah.
It's like this utopia of everybody on their wooden bicycles or whatever. So,
yeah.
So yeah, I mean, that made me sort of stop and think, why Denmark, basically?
Yeah, exactly. Let's start there. A big reason the US government says that it's making this change, it's not because there's a bunch of new vaccine science saying that vaccines aren't safe anymore. It is because we're trying to match up with what other countries are doing, like Denmark. So to find out how Denmark thinks about all this, we went directly to the source. The Danish I had for breakfast.
Meryl, go to your room. Unacceptable punning.
We actually talked to Jens Lundgren. He's a professor of
He's a Danish?
Yes, he's a professor of infectious diseases at the University of Copenhagen. And Jens actually advises the Danish Health Authority on which vaccines to recommend to the Danes. Do you remember the first time you heard that the US was kind of using Denmark as a model, and what you thought when you heard that?
No, I felt that was very surprising to make that analogy and then just uncritically adopt it. So that was surprising to me, I have to say.
Yeah, do you know why we use Denmark in particular?
That's probably more for you to answer than me.
Right. So yeah, I went back and did my homework, and so there was this memo from the White House in December where President Trump praised Denmark along with a few other high-income countries, basically for just doing fewer childhood vaccines. And then Trump called for a review on the U.S. schedule to see if it should make any changes. And of course, you know, they did. So I wanted to understand, like, why does Denmark recommend vaccinating against fewer diseases?
Yeah, I have that question.
Yeah, and Jens said that, you know, a bunch of things factor into this decision for them of whether or not to recommend a vaccine. So how effective the vaccine is, the cost, and then there's how common the disease is. So basically, you do have to do a math problem to consider, you know, if you're trying to decide if everyone needs a certain vaccine, you need to think about how many cases of a disease you're going to prevent by vaccinating everyone in the population.
We would argue that if we need to vaccinate is extraordinarily large in order to reduce the risk for one person for contracting a disease, then that's a legitimate discussion to have about whether it's worthwhile to introduce the vaccine, although it is effective.
Yeah, and so this is one reason why Denmark might not want to vaccinate every kid. Some diseases are pretty rare. So an example here that I think is helpful is meningococcal disease, which can cause meningitis. And this is one of the vaccines that the CDC just changed the recommendations around. So if you look at the number of people who get meningitis every year, it is less than one case in every 100,000 people, both in the US and in Denmark. So what do you know about meningitis, by the way, Rose?
That's the one that college students get when they live in the dorms, right? And it makes your brain swell, and it's actually very, very dangerous. Is that right?
Yeah, exactly. It's really terrible. It's often caused by a bacteria, and it can affect tissues around your brain, which can lead to this huge immune reaction where it can basically make your brain puff up so much that you die. So when people get it in the US, maybe 10 to 15% of them will die. Sometimes it happens really quickly, like within 24 hours. But, you know, that hasn't been enough for Denmark to recommend the vaccine for every kid. Here's Jens.
It is scary, yes, and it's a serious condition, but it's also rare. And therefore, for a pneumococcal vaccine, now the question will become, do you vaccinate blanket-wide, so everybody? Or are you focusing your vaccination efforts if there's an outbreak? And we have chosen the latter.
So basically, they'll go and vaccinate people surrounding the person that gets it.
Yeah, that's the idea. Kind of a more targeted approach there. I talked about this with another researcher, though, David Higgins. He's a pediatrician and researcher in Colorado. And he said that if you want to give the vaccines, like, only when you've got an outbreak, then, like, in order for this to work, you really have to have your little, like, healthcare ducks all in a row.
You have to catch these diseases really fast. You have to quickly be able to find all of their contacts and that ring around the cases to vaccinate them and get vaccines to them. That requires a health system and a public health system that is really well resourced, that doesn't have a lot of gaps and cracks in it where things can fall through. That requires really good access to healthcare. We don't have those things in the US.
Yeah, I could see how that would be harder to do here.
There's a lot more cracks. Yeah, it's more fragmented, right? We don't have a national healthcare system like they do. And just a side note, the system doesn't work perfectly in Denmark either. So in 2024, Denmark had 26 known cases of meningococcal disease. And they did this contact tracing and found more than 100 people who were close contacts of people who got it and told them to get vaccinated. But they were only able to confirm that half of those people actually got the vaccine. And, you know, the fact that the US has been vaccinating kids for meningitis routinely, it saved lives. So one modeling paper estimated that the vaccine prevented about 500 meningitis cases and 54 deaths in young people. So that was over a period of about 15 years.
Another thought I have, Meryl, is if we're talking about how rare a disease is, sometimes diseases are rare because many people are vaccinated. Yeah.
Yeah, no, that's another good point, right? We're kind of ignoring that fact when we just look at how rare it is today.
Well, could you argue that Denmark is benefiting from the U.S. vaccinating more people in our population, so it's just suppressing meningitis around the world generally?
Well, actually, a lot of other European countries do vaccinate for meningitis, and in some cases, they do it even earlier than the U.S. does.
So Denmark is a freeloader off
Yeah,
everyone else's vaccination status.
basically. So yeah, that's kind of one factor that Denmark is looking at, though. You know how common a disease is. Another reason I talked about with Jens for like why they might not recommend a vaccine for every kid is about how deadly the disease is. So an example of this would be rotavirus.
Yeah, what is that, by the way? Like, I've only heard it in this context. I have never heard of that disease.
I had no idea either before this episode. But yeah, it's, well, first of all, it is really, really common. So in the US, before the vaccine, basically every kid was getting rotavirus by the time they were 5 years old. And this one, it infects your GI tract and can cause really bad diarrhea. And it can get so bad that it will land kids in the hospital. And so, yeah, I asked Jens about why they don't recommend vaccinating against this, and he said a lot of factors go into it, but one thing is that it is treatable.
It's not something, at least in our context, that we see as a terribly serious disease.
Again, they're confident that a kid who has a bad case of rotavirus can get to a hospital and be treated.
Yeah, the healthcare system really matters for that too, right? And then, you know, if you look at the numbers in the US, vaccinating has kept a bunch of kids out of the hospital. So the CDC has calculated that the vaccine prevents 62,000 emergency department visits and 45,000 hospitalizations every year from rotavirus. Which to me does make me glad that like my kids are vaccinated against it. Like even if it's not going to kill them, I don't want them to go to the ER.
Well, yeah, I mean that's the thing with kids and getting sick. Kids get sick a lot, and just hope that your kid is going to have an okay case over it, and that's just part of life. But you don't know if your kid's going to be the one that gets really, really sick from something, and if someone in the family has to go to the hospital, that's really disruptive and scary for the kid. Like, I'm thinking about vaccines for childhood diseases that are typically fairly not life-threatening, but very unpleasant.
Yeah.
So one that comes to mind for me is the chickenpox vaccine, which did not exist when I was little.
Me neither, yeah.
One of my earliest memories is like being in the bathtub and some kind of weird solution they give for being covered in sores, you know, pox. And being in the bathtub, my mom next to me, and me just crying because I was so miserable. Feeling awful, and I got it, both my brothers got it, and the whole family was just like, so we were all fine, we got through it, but it's like, it'd be nice to not have that happen. Like, I don't see, like, that's good. You don't have to, like, be sick and
it's still recommended for everyone.
Yeah, and I'm jealous. You kids today, you don't even know what we have to go through.
What it makes me think of is just how many sicknesses my young kids are already getting every single winter. It's so brutal. It's just like one after another, after another, after another.
Yeah, everyone on the team who has little kids is like constantly like someone's kid is always sick at science versus.
And I'm just sort of imagining a parallel universe where rotavirus was also one that like all the moms would like complain about on the group chat, like, oh, my kid has like diarrhea for like a week, and like that sounds like a bad alternate universe. Like I'm glad we live in this one where they got some stuff like it's like oral vaccine, so my kids got something squirted into their mouths. I kind of barely even remember this happening, but yeah, now it does sort of feel like we're going backward with this rotavirus vaccine to this time where some kids might now be missing out on it. But yeah, just to go back to the idea that, you know, we want to just be like emulating another country's vaccine schedule. A lot of the people we talked to said that it just doesn't make sense to do this, like plop one country's vaccine schedule into another's. Here's David.
You can't copy and paste the vaccine schedule from another country and expect it to work in the same way that it does in a different context like the US.
Why, Meryl? Because diseases are diseases. It's just biology. Borders are made up.
Stop trolling me.
Convince me.
Well, like for one, which country do you pick then, right? Because this idea that we need to align with other countries that do fewer vaccines has been around for a while.
One of the things that's brought up is like, okay, the US is an outlier, right? We have vaccines for 18 diseases, Denmark has vaccines for only 10, and Japan 14, and Germany only 15. So we are an outlier, and we need to align with peers. Not only are those countries cherry picked, because I can count other countries that have a very similar schedule to ours, like Canada, Australia, New Zealand, but also the fact that we have coverage for more diseases is not evidence of a problem. That's backward. It's not a competition to see how few diseases we can prevent.
I don't know, some people seem to think that.
Yeah.
But no, I mean, another way to, I'm thinking back to that baby surrounded by the needles infographic we talked about in the beginning. Like, the baby on the left with fewer syringes around it had a lot of like gaps in its shield, and the baby on the right was like fully shielded. So you could completely switch how you look at that.
Yeah. We should make our own infographic. And so, and then to pick, Denmark and then ignore, Canada and Australia and New Zealand is a little, is a little random.
Other peer countries.
Yeah. And then, of course, there are countries that are adding vaccines to their schedule, including Denmark. So, yeah, they just added RSV during pregnancy, this awful respiratory virus. The UK just added varicella, chickenpox, to their list. So this idea that the U.S. needs to match up with some other country, it's a moving target anyway.
Some of them are trying to match up with us, previous us.
Yeah, actually we heard that too. So we actually reached out to experts in other countries to ask them what they thought of these changes in the U.S. and they all told us that it was surprising. One of them told us, quote, "It is like watching a train wreck in slow motion," unquote.
Yeah, that's kind of what it feels like, for sure. From the inside, too. Being in a train wreck in slow motion.
Yeah, and, we did reach out to the Health and Human Services Department. They basically defended this decision. They said in a statement that, quote, "Evidence from peer-developed nations shows high vaccination rates can be achieved through trust in public health, education, and strong doctor-patient relationships," unquote. And they also pointed out the access thing, saying that, quote, "Insurance will continue to cover more vaccines for children in the U.S. than in peer nations," unquote. All right, so after the break, what's next? What's going to happen from here?
Yeah, we're all going to be staggering around with our rotavirus coming out our buttholes.
After the break.
At MedCan, we know that life's greatest moments are built on a foundation of good health, from the big milestones to the quiet wins. That's why our annual health assessment offers a physician-led, full-body checkup that provides a clear picture of your health today and may uncover early signs of conditions like heart disease and cancer. A healthier you means more moments to cherish. Take control of your well-being and book an assessment today. MedCan. Live well for life. Visit medcan.com/moments to get started.
Welcome back. This is Meryl. And we just heard some reasons why experts don't think it makes sense to cosplay as Denmark.
They're like, black licorice is gross.
Yeah. But the other thing we wanted to know is how much do these changes actually matter? How big a deal is this? I talked about this with David Higgins, who you heard from before. So on a scale from 1 to 10, how big of a vaccine emergency is this?
Well, I would say that this is an 8.
Huh.
An 8 or 9.
Whoa.
Okay. Now, here's why. I think that a 10 would be the no access to some life-saving vaccines that parents want to choose for their children or that we want to get as patients. This, in some ways, does still preserve some choice.
Because your parents still can get these if they want them, is that right?
That's right, except it is a big deal, and here's why. Because over time, this is likely to decrease the availability and access for parents who want to vaccinate their children.
So yeah, David's worried that even if parents still technically have access to these vaccines, these changes have injected some confusion into the system. Since, it's a lot easier to just say, like, here's your list of shots, go and get them, than to have people figure out, like, is my kid high risk, or should we do this thing where I need to talk to my doctor? So one example where this does get really confusing is RSV, which is really terrible. Here's David.
RSV is just a horrible, nasty virus that every pediatrician, every winter, we're just swimming in RSV. Kids get super snotty with it. And I have admitted more kids to the hospital, put more kids on oxygen, and had more complications than any other disease, by far. And these are in healthy kids, right? We had a particularly bad RSV season several seasons ago, and I remember walking into the emergency department for a shift several times, and walking in, and the waiting room is filled with kids on oxygen that hadn't even been seen yet.
And so, yeah, it's terrible. And one thing that's exciting is that we do have these new ways of protecting babies against it. But so let me tell you about how it works, because it is really complicated and it's taken me forever to wrap my head around it.
You mean how the vaccine works?
Yeah, for starters, the vaccine itself is kind of a weird one. So the vaccine was approved in 2023 for pregnant people. But then at the same time, we got a separate treatment, not a vaccine, but something called monoclonal antibodies that babies can get after they're born. So if the mom didn't get the shot when she was pregnant, then the babies can take the antibodies, and these both work pretty well. Okay, so in the old recommendations, you had RSV at the top of the list, primo placement, saying babies should get these antibodies right away when they're born, specifically if the mom hadn't been vaccinated or they didn't know her vaccine status. But now when you look at the new recommendations and you look at where RSV is listed, it's in this whole new category that's further down of kids who are, quote, high risk. And this could mean that the kid has chronic health problems, but it could also mean that your mom didn't get the vaccine. Like, that makes you high risk too. And that actually could be a lot of kids, because the vaccine is only recommended if you're in a certain stage of pregnancy at a certain time of year.
Well, so it sounds like what you're saying is, because the vaccination of people during pregnancy is not universal by any means, a lot of kids are going to be born without having been vaccinated while in the womb, which makes them a candidate for a high risk. But
yeah,
it's not clear maybe that your kid is high risk just because you didn't get the vaccine. You have to know that.
It's tricky, yeah. And David pointed out that this detail is kind of tucked into a footnote in this new schedule.
Parents are going to look at the schedule and say, they're not going to read the footnote. How this is described is in a footnote. They're going to see the schedule, the nice colors, and say, oh, my child's not high risk.
Yeah.
They had a normal pregnancy. We left the hospital after 2 days, and everyone said, your baby's healthy and great. Why should they be getting this? So that's my concern with that one.
Yeah, that is really confusing.
Yeah, and this point about confusion, we're already seeing this play out. Like for me, Rose.
Even you?
Yeah, I am one of these confused parents. Not because of RSV, but actually a different vaccine. So okay. So last week I took my son to the pediatrician. He's 2, and the doctor was basically like, "Good news, you don't need any vaccines today." So he would have needed the hepatitis A vaccine, but now that's not on the schedule for everyone. And she told me, that's fine because there's barely any Hep A in the U.S. anyway.
Okay.
And in the moment, I was relieved because I didn't have to watch my toddler scream cry. But then I left the appointment not really sure what to think. So I asked David about Hep A.
Hepatitis A is a good example where prior to using the vaccine, especially kind of through the 90s, it was spreading through our communities. Now, what the vaccine has done is it stopped that spread.
Just as recent as the 90s, though, it was out there.
That's right. That's right.
Huh.
And so we because so many people in the community, especially kids, are protected with the vaccine, we don't see it spreading routinely through the community. That doesn't mean that it's not out there. It is still out there and can still absolutely come right back. So vaccines are victims of their own success, right? We use it, it works, and then people start questioning why it's necessary.
Yeah.
Because they don't see it anymore, because the vaccine worked. And unfortunately, these diseases, when we stop vaccinating, they're being held at bay with vaccines. They're not eradicated.
So what does that mean for your 2-year-old, Meryl? Are you going to go and get him the shot?
Yeah, actually, I'm like, okay, I need to put this on my to-do list for the next time we go back, especially because hepatitis A is still really common in other parts of traveling. It just makes it more messy.
Mm-hmm.
We are a very interconnected world where one of these diseases is only a plane flight away and can be introduced to a community that has a vaccination rate that's way too low. And what's going to happen? Well, I think of it like a dry forest and sparks being thrown into the dry forest. Eventually, that spark's going to land in the wrong place, and it's going to start a wildfire.
And, you know, going to a different disease now, we are seeing some of this with resurgence with measles in the U.S. right now, right? Like we've got that spreading, especially in these unvaxxed communities. And it's happening in other countries too, like Canada. They've lost their status as a country that's eliminated measles, and we might too. Mm-hmm. And that's going on even though the official recommendations still tell you to get your kid vaccinated for it.
Mm-hmm.
And so, yeah, you know, with these new recommendations, there's this concern that parents won't know what to do, that a lot of the vaccines sort of feel optional. So I asked David, should parents still get all of these vaccines for their kids?
I still recommend all of the vaccines that are on the American Academy of Pediatrics vaccine schedule. That is what I'm looking to. That is what I am recommending for my families. That is what I'm telling other clinicians and vaccination providers to look at.
And so that hasn't changed
Mm-hmm.
with these new recommendations from the federal government.
Yeah, so the AAP still basically abides by the old schedule that the CDC used to have before this recent change.
Mm-hmm.
David says that, you know, best case scenario is that people do that. They keep following that old schedule. But that's not necessarily what he thinks is most likely.
Mm.
Well, I wish I had a crystal ball, and I don't. Right? I am concerned that this is one step among more steps to come that are going to continue to erode trust or availability of vaccines. I don't think we're done here. I think in this next year, we're going to see more and more things happen. They're going to make parents question, that are going to make parents hesitant, not because the science changes. And unfortunately, I think what we're going to see is when parents want to vaccinate, it's going to become harder and harder. There are going to be more barriers, more things that they have to overcome to get their kids vaccinated when they want to.
I'm Joe Graydon.
And I'm Terry Graydon. Welcome to this podcast of the People's Pharmacy.
You can find previous podcasts and more information on a range of health topics at peoplespharmacy.com. How do you catch the flu, COVID, or a cold? Such respiratory infections are transmitted through airborne viruses. This is the People's Pharmacy with Terry and Joe Graydon.
Dr. Lindsay Marr is one of the country's leading experts on air quality. She was among the first scientists to identify airborne transmission as a problem during the COVID pandemic.
Dr. Marr will tell us how we can improve the quality of the air we breathe.
Do you know how well the air in your home is filtered? What about the air quality at school, at work, or in your doctor's office?
Coming up on the People's Pharmacy, how cleaner indoor air reduces your risk of infection.
In the People's Pharmacy Health headlines, viruses are on the move through the air and on surfaces. Subclade K type A H3N2 influenza is spreading. People catch it primarily by inhaling invisible viral particles. Public health authorities are worried that current influenza vaccines may not protect well against this new variant. The other virus that's causing a lot of misery is norovirus, also known as stomach flu, the cruise ship virus, or the winter vomiting bug. It's one of the most easily transmitted infections because just a few particles can make you very sick. Wastewater scan shows a significant uptick in the last couple of weeks. If anyone in your household starts throwing up or having diarrhea, you're at risk of catching this virus. That's because it can be transmitted through the air. There is no vaccine or effective treatment against norovirus.
Nutrition experts have been arguing about fat for decades. Starting in the 1980s, Americans were encouraged to follow a low-fat diet. Instead of using butter, people were told to use vegetable oil. Saturated fat was the enemy because it was thought to clog coronary arteries. Hydrogenated vegetable oils were promoted because they had no cholesterol. And seed oils, such as peanut, corn, and safflower oils, became popular because they too were low in saturated fat. In recent years, though, researchers became concerned that hydrogenated vegetable oils contributed to atherosclerosis. And now, researchers at the University of California, Riverside report on an experiment with soybean oil. Mice fed on soybean oil developed obesity more easily than those fed coconut oil. The investigators identified a liver protein that determines how the body handles linoleic acid, a major component of soybean oil and some other vegetable oils. They point out that many processed foods contain soybean oil, which could be contributing to the obesity epidemic.
Diet can play an important role in controlling blood sugar for people with type 2 diabetes. A study published in the American Journal of Clinical Nutrition demonstrates that slowly digestible starch can be very helpful. Because this slowly digestible starch is metabolized over a long time, it does not lead to spikes in blood glucose or insulin. Investigators recruited 51 people with type 2 diabetes and randomly assigned them to diets either high or low in slowly digestible starch. For 3 months, the volunteers kept track of their blood sugar with continuous glucose monitors. They also met with dietitians for nutritional and culinary counseling. Those whose diets were high in slowly digestible starches such as peas and beans, nuts and seeds, and whole grains had less dramatic changes in blood sugar. Both groups lowered their levels of HbA1c, a medium-term measure of blood sugar. Those on the diets rich in slowly digestible starches actually got their A1c below 7%, which was the target. The researchers believe this offers an effective and accessible strategy to help people with type 2 diabetes gain control.
Australia's equivalent to the Food and Drug Administration is called the Therapeutic Goods Administration, or TGA. Like the FDA, it monitors drug safety. Recently, the TGA issued a new safety alert to people using GLP-1 drugs such as semaglutide, tirzepatide, liraglutide, and dulaglutide. These drugs have become household names such as Ozempic, Wegovy, Mounjaro, and Zepbound. The TGA is concerned about reports of suicidal thoughts and behaviors associated with these medications. The regulatory agency is urging doctors to monitor patients for the emergence or worsening of depression, suicidal thoughts or behaviors, and or any unusual changes in mood or behavior.
Residents of several states are being warned to stay indoors because of poor air quality. High levels of ozone or fine particulates too small to see are making breathing dangerous in many places. You can check your local air quality index at the website airnow.gov. And that's the health news from the People's Pharmacy this week. Welcome to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. We're entering cold and flu season, except there are lots of other pathogens circulating in the air we breathe.
We can't see them because they're much too little. Infectious agents such as respiratory syncytial virus, human metapneumovirus, pertussis, and Mycoplasma pneumoniae can cause a lot of misery.
And let's not forget that SARS-CoV-2 has not disappeared. This year, a new variant of influenza A, subclade K, is making people sick, and the flu shot may not protect us as well as we'd hoped.
To find out why air quality matters, especially when pathogens are circulating, Joe talked to Dr. Lindsay Marr. She's a professor of civil and environmental engineering at Virginia Tech, where she leads the applied interdisciplinary research in air laboratory. Her research group focuses on the dynamics of biological aerosols, like viruses, bacteria, and fungi, in indoor and outdoor air.
Welcome to the People's Pharmacy. It's so nice to have you back, Dr. Lindsay Marr.
I am thrilled to be here, to be back on the People's Pharmacy. Thanks so much for having me again.
Well, unfortunately, Terry can't be with us today, but I am so pleased to find that you have received so many awards and recognition for the work that you have put in over the last 5 years, especially with regard to COVID. I mean, you are an environmental engineer. You've been involved in bioengineering for a long time, and it seemed like COVID was just waiting for somebody with your expertise to come along. Can you tell our listeners what is an environmental engineer? And how did you get interested in aerosol viruses? Because you were into this field before there was COVID-19.
Right. Environmental engineers dedicate their careers to ensuring that we have a clean and healthy environment, whether it's in the natural environment and also in the built environment. The built environment are buildings and roads and other infrastructure. And so, for example, some environmental engineers focus on clean water. We take it for granted that you can turn on your tap and get clean water that is safe to drink, but that wasn't always true. And that development was thanks to the work of environmental engineers. Another example is that of clean air. Air in the U.S. used to be much dirtier than dirty cars and the steel industry and other sources, and environmental engineers are the ones who kind of recognize this and helped lead, I guess, research and actions to help clean it up.
Now, I'm saying that COVID changed your world, but you were already in this field. You were already interested. Tell us how COVID did make a difference in your life.
Yeah, I had been studying viruses in the air since about 2008 or 2009, and I got into it mainly, for a couple of reasons. One, I had been studying traditional particulate pollution in the air. As I mentioned, environmental engineers study air pollution. And then a second reason is that I had a child in the end of 2007, and he had started daycare and was getting sick all the time. So I really became both fascinated and frustrated by the rapid spread of disease in daycare centers. And so I started reading up on this and found out that we really didn't know as much as it seemed. And what I did read about how the flu spreads between people, some of it just didn't really make sense with my understanding of how particles move through the air. And so my research group started out by going into daycare centers, a health center on campus, and airplanes. We collected air samples, really particles in the air, and analyzed those and found the flu virus present in like half of them. And it was in small enough particles that they would stay in the air for a long period of time, float around, and people could breathe them in. And after several hours, they could breathe in enough to become infected.
So you were already beginning to suspect that viruses could float on the air, and then along comes COVID, and the CDC and the World Health Organization, all these public health experts were saying 6 feet. As long as you're, 8 feet away from somebody who's infected, you're home free, no worries. And you were going, whoa, wait a minute.
Yeah. And all of a sudden, all the research I had been doing for the previous 10 years really was here, and I had been studying this because I was worried about a new flu pandemic. It wasn't flu, but it turned out to be a coronavirus. And then there was this constant messaging about, stay 6 feet away from people and that'll protect you. And I knew from what I've been studying that was likely not true. And it was based on some older, let's say, kind of dogma or just dogma about how respiratory virus is transmitted, that it was mainly in these large droplets that people cough or sneeze into your face, big enough to see, and they're large enough and heavy enough to fall to the ground within 6 feet of anyone who coughed them out. So that, if that were true, then if you stayed at least 6 feet away, then there would be no way that you could contact with the viruses being emitted by other people. But it turns out that, based on research I had done earlier and putting together a lot of studies that other people had done, even going back to the 1940s, I knew that people, whether they're infected with a respiratory virus or not, but that they emit particles, respiratory particles of all sizes, both those large wet ones when you cough, but also smaller stuff when you talk, and even some people when they breathe. And based on older studies, I knew that the virus could be present in those across the whole size range and could also survive in those. And so the idea of the 6 foot distancing, to me, it just didn't sound like enough. It was I think it was due to a misunderstanding about how this type of virus would transmit.
What surprises me in retrospect is that the 6 foot rule kind of lasted a long time. It made no sense, and I kept wondering, well, where did it even come from? But I think your research and your colleagues' work demonstrated pretty effectively that viral particles could float through the air, not for a few minutes and not for 6 feet, but for a long time and a greater distance, a much greater distance. So when did we finally begin to recognize that 6 feet wasn't going to be the answer?
I think it was a gradual series of kind of research studies and also observations of super spreading and other types of events that helped us realize that the 6 feet wasn't enough. And I should say that 6 feet is helpful because it does keep you kind of a little farther away from the most concentrated plume. If you imagine somebody's talking, there's a kind of a plume of air coming out if they're smoking a cigarette, and you want to stay away from that. So 6 feet is good for staying away from that, but it's not going to absolutely protect you from breathing in those smoke or other respiratory particles. But there were a number of things that happened. So one was that there was the outbreak in the Skagit Valley Chorale in early March of 2020, I believe, where there was a choir that went to a rehearsal, and maybe 1 or 2 people were infected. They didn't feel quite well. The group, knew that there was this new virus around, so they did shaking hands, touching each other, and yet still something like over 80% of the members of the choir became infected after that practice. So that to me was like one sign of, this thing is probably in the air, because it's really hard to infect that many people just by touching the same doorknob. Even if everybody did touch the same doorknob, after the first few people touch it, any virus that was on there will probably have been removed. So that was one thing. And then there was a study that came out of China in a hospital where they did aerosol particle sampling, the very small particles. Now it was the viral RNA, like its genetic signature. It wasn't infectious virus, and so some people said, it's not infectious, that doesn't prove anything. But we know that it's really hard to maintain infectious virus when you're sampling from air. So that was another hint that it could be there. And then there were additional studies finally, I think later that summer, there was a group that sampled air in a hospital where there were patients, and it was more than 6 feet away from their beds, and they used a newer sampling device that is gentler and helps better keeps the virus infectious, and they discovered a lot of infectious virus in the air in those samples.
So there was enough evidence that accumulated over those first year or two that people began to recognize, but they didn't really want to believe it. And in a sense, there was like, well, we don't want a mask because that's a pain in the neck, and we aren't going to change our heating. And so nobody really knew what to do about it, including, I think, a lot of the public health people. We just have about a minute left before we take a break, but have we learned from COVID? Have we made changes that are significant so that it won't happen again?
I think we have learned. There's a totally new discussion about transmission of viruses through the air that used to be completely absent or was reserved for really special cases, but I think now it's understood to be widely applicable to colds and flus. And then, for example, I think the CDC, Centers for Disease Control, had a new website where they recommended a certain amount of ventilation, minimum ventilation in rooms. And so that's progress. That's something that did not exist before.
Well, when we come back after this break, let's talk about progress and what we need to do in the future to prevent another pandemic.
You're listening to Dr. Lindsay Marr, Professor of Civil and Environmental Engineering at Virginia Tech. She leads the AIR2 laboratory, which focuses on the dynamics of biological aerosols, like viruses, bacteria, and fungi, in indoor and outdoor air.
After the break, we'll learn about other pathogens in the air besides viruses.
Researchers pay attention to the size of the particles that are wafted around indoors. How do they affect our health?
If you have to spend time where there might be a lot of pathogens in the air, are there ways to protect yourself?
Which places are especially dangerous? Are some public places we should be extra cautious?
Air filters might help. How could we improve ventilation and filtration?
You're listening to The People's Pharmacy with Joe and Terry Graydon.
This podcast is brought to you in part by Caraway.
Black Friday may be history, but Caraway is still having a site-wide holiday sale, so you can get up to 25% off their beautiful cookware and other wonderful kitchen products. If you, like us, haven't quite found the perfect gift for everyone on your list, you'll definitely want to check out CarawayHome.com.
We love our Caraway cookware. It's so pretty. I want to bring it to the table to serve the food. It's cooked so well. No sticking, no burning, and most especially no toxic chemicals. It's just perfect for your favorite winter comfort food, whether it's a hearty chili or a flavorful stew.
Food prep and storage is a lot better with Caraway too. Get rid of those plastic cutting boards that leave your food laced with tiny plastic particles you can't see, but you do eat. Instead, opt for their functional and attractive wooden butcher block cutting boards. Glass storage containers are better than plastic ones too.
The holidays are closer than ever, so make sure you order by December 15th to get their gift or yours underneath the tree in time. Visit carawayhome.com/PPOD to take advantage of this limited time offer for up to 25% off your next purchase. Again, that's Caraway, starting with a C, carawayhome.com/PPOD to get new kitchenware before the holidays. Caraway, non-toxic kitchenware made modern.
Prime One Day delivery is fast. How fast are we talking? We're talking game night delivered by tomorrow night fast, so we can win fast. Cards fast, puzzles fast, team games at your door in a day fast. Doesn't matter what the game is, we will dominate fast. We're talking game over, you win fast. Fast One Day delivery for the win. It's on Prime.
Welcome back to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. The People's Pharmacy is brought to you in part by Sonu, an FDA-approved drug-free treatment for nasal congestion and runny nose, using sound instead of steroids. More at getsonu.com. That's getsonu.com.
Air quality is important for health, but public health experts have not required landlords to install high-efficiency filters or UV lights to eradicate pathogens. Is there anything we can do to monitor air quality and protect ourselves from airborne pathogens?
I was on assignment out of town and could not participate in this interview with Dr. Lindsay Marr. She is one of the country's leading experts on indoor air quality. She's focused her research on the dynamics of biological aerosols such as viruses, bacteria, and fungi. Dr. Marr is professor of civil and environmental engineering at Virginia Tech and leads the Air2 laboratory.
Dr. Lindsay Marr, we've been talking about COVID, a virus, but there are all kinds of pathogens that float in the air besides viruses like influenza and COVID, SARS-CoV-2. Tell us about the size of the particles, whether it's a bacteria or whether we're talking fungi or some other pathogen, and how all of the stuff that's in our environment, whether it's inside or outside, may affect our health.
Yeah, there's a whole life world of microscopic organisms in the air around us, and bacteria are around 1 micron in size, and to put that in perspective, a strand of your hair is probably 50 to 100 microns in diameter. So imagine something that's 1/50th to 100th that size. Fungi might be that size or a little bigger. Viruses are smaller than that bacterium, maybe like the coronavirus and flu viruses are around 0.1 microns, so 1/10 the size of the bacterium. But those things do not float around naked. They're released from a respiratory tract, or with bacteria, it might be splashed out of water somewhere, or blown out of soil. And so there's a particle that is carrying the virus or bacterium or fungi, but often usually it carries other things from that fluid. So like our respiratory fluid, your saliva, sure, it's liquidy, but if all that water evaporates, you're left behind with a lot of salts and proteins and other organic material. And in fact, that amount of material, you have 100,000 times as much of that other material, mucus, salty stuff, than you would the amount of virus in it. So these things are all around us. They're very tiny. We can't see them, but they're there.
Well, you've used the metaphor of smoke, and I think it's really, it's a great example. If you enter a room where somebody has been smoking a cigar, you will know it instantly because it smells. You probably won't see the smoke, especially if they were in the room maybe 30 minutes before you walked in and they had left. But the idea that there are still those smoke particles floating through the air and you can smell them, that kind of is a wake-up call that whenever we walk into any room, almost anywhere, there are going to be particles, especially if there are a lot of people in that room. And I think of concerts, I think of sporting events, basketball season, and thousands of people all screaming their lungs out, some of them sneezing. And I've seen your video that you've shown with people sneezing, and it's really scary. And so there are a lot of venues where you're going to be breathing in a lot of different pathogens. And the question is, why are some people more likely to get sick than others? We got a lot of email from people who said, I don't worry about that stuff because my immune system is so good. I take lots of vitamins and nutrients and I can ward off anything. And then I'm thinking, but what about norovirus? If you walk into a bathroom where somebody threw up or had diarrhea, there are going to be norovirus particles floating through that public restroom. Or what about influenza? Or just, there are so many kinds of pathogens out there. So I guess the question becomes one of, we can't see this stuff, but it's there. How do we protect ourselves?
Oh, we covered a lot in that question. So that's a great question. Let me go back to the cigar. So what we are smelling is often the gases that are in there, not the actual particles. Although if the gases are present, there may still be a few smoke particles around. And then in terms of kind of particles in the air all around us, even in a room that appears clean, a typical amount of particles in the air, and this is not just like microbial stuff, but just particles of all kinds, is you would have like 1,000 particles per cubic centimeter. A cubic centimeter is roughly the size of a sugar cube. So you take a big deep breath in, and you're breathing in like 1 million particles, and a lot of those come back out, but some of them do deposit, and some of them are salt and other organic material, and lots of different materials. Only a small fraction of them are actually microbes, and an even smaller fraction of those are actually pathogens. And so how do we protect ourselves in these types of places where they're all around us? Well, it's the fact that the pathogen is in the air and you breathe it in is only one part of the equation of whether you're going to get infected and sick or not, because indeed your immune system plays a big role here in trying to fight off these pathogens, and that response is going to vary hugely from individual to individual.